My name is Dr. David Noel. I'm trained as a dentist. And this is my daughter, Allison Dawn Noel. And Allison was born severely developmentally delayed and with severe retardation. Allie doesn't speak, and she's 13 years old. She's still working on her toilet training. And with regards to dental health and taking care of her oral hygiene, it's been quite an interesting path. And our purpose today is to describe how we got from the point at the beginning when we had to make decisions about how basically to take care of Allie's oral health needs to today, where she's extremely cooperative, and we feel that currently she's experiencing a great deal of success in keeping her mouth healthy. Allie was very combative at first, as many developmentally delayed people are, with regards to working on her brushing and flossing. She fought people off who tried to do it and would not cooperate. Our family has noticed that there have been many people who give up at that point, and they wind up just resigning themselves to taking their child in and having to have dental services done in the hospital or having special kinds of treatment done. But what we did with Allie is we basically worked on her with a gradient, where we started out at the beginning working with cleaning her teeth ourselves, and little by little she began to cooperate, and we just never gave up. Sometimes we had to use a rather strict regimen, other times she became cooperative. So we never gave up, and that's really the ultimate message.
Ali, te voy a lavar los dientes. Tenemos un Kleenex y primero limpiamos la nariz.
Well, Jovita takes care of Allie when she prepares her in the morning. She has to be bathed and dressed, and in that kind of pattern and that kind of regimen, Jovita found that by standing up, she could achieve the goal of getting to all the areas using the correct brushing technique and flossing. And that's really what worked individually for Jovita and Allie. That came well after the training that I did with Allie, which oftentimes was just Allie and I with the door closed and making it quite clear that Allie was not going to leave the room until she began to cooperate. So each person who intervenes develops their own role. Jovita came on the scene after Allie finally, if you will, capitulated and basically agreed that a daily brushing and flossing was the correct thing to do, and the particular technique that Jovita uses works for her. For me, I'm trained as a dentist, and when I work with Allie to get her teeth brushed and flossed, I prefer to have a real good access, a real good visual view, and I kind of like to check every now and then on how Jovita's doing and how Allie's oral health is.
We're demonstrating here some various methods that can be used, along with even such things as the dog. We have music therapy here, we have canine therapy, and underneath all this, we stress the hygiene aspects of this care.
Give him a big hug. Give him his kiss. Good job,
So
Maria.
the main message I would give is that the reward of getting somebody, really anybody's, teeth well brushed, correctly brushed, and correctly flossed every day or twice a day or whatever is needed and wanted by that person in order to eliminate dental disease is certainly far better than the kind of interventions that are needed by going into the dental office. Some people have to be put under general anesthesia just to have their dental work done. And that's certainly a terrible price to pay, as opposed to getting good brushing and good flossing and good oral hygiene. So the ultimate message, never give up. It's worth it to fight the war to get every person's teeth brushed and flossed well, so that the drilling, possible pain, possible restorative work that conventional dentistry requires to fix a diseased mouth is eliminated. Yes, preventing the disease is totally possible. Dental disease is a disease that can be totally prevented by brushing and flossing and appropriate care. So let's get rid of dental decay and gum disease so people don't have to have surgery to fix it.
How did your experience as a father of a special needs child affect and influence your work in public health?
That's a wonderful question. Brings a lot of very positive thoughts to me. My daughter, Allison, passed away at birth and was resuscitated. And for 30 years, she was treated as a severely developmentally disabled and mentally retarded person. And she taught us, really. She taught us about the significance of an individual human being, regardless of their abilities, and what we can all do as a family, as a group, as a nation, as a world, to acknowledge people who are different in all kinds of different ways. In this case, with Allie, the fact that she was mentally retarded and what is called developmentally delayed, but taught us things about communication and life that we would have never had. Pardon the emotional content.
No, we understand.
Yeah, thanks for asking.
Now, when you dealt with her in relation to caring for her dental needs, how did that work in the very beginning, and how did you come to the protocol of dealing with her and her dental needs and developing a rapport with her and get her so cooperative over the years?
By the way, your last three words were very important. Over the years.
Over the years.
At first, it was the World Wrestling Federation. we were trying things that we had no training in. She has two older brothers who have, right from the beginning, adapted to the regimen of oral health care that we're talking about in this subject and in this video. And Allie battled. She didn't want anybody coming near her mouth with anything other than offering her food, which she then, would enjoy immensely. So it was a battle, and step by step and repetition by repetition. And then also in the literature nowadays, this was 30 years ago from now, as this taping is in 2015, 30 years ago is when Allie's teeth, when she was born and when her first teeth were erupting. It was a continuous process for the first few years. But in cooperation with other people, including various caregivers eventually, when Allie moved out of the house, Allie never got a cavity.
Wow. That's
she
remarkable.
Pardon me, but she at the beginning she did have a demineralized spot, a little technical there, but it was remineralized very quickly, and it was just one day at a time, incremental improvement, until she realized that it was something that was intuitively very useful. I'm sure she must have experienced the cleanliness of it, the odor, the taste, and she never had a cavity.
That is remarkable.
Yeah.
That is really remarkable.
That's quite incredible.